All right. Good morning or good afternoon, depending on what part of the country that you are in. My name is Venus Standard. I am a certified nurse midwife here in North Carolina at the University of North Carolina Department of Family Medicine. And I want to welcome you to the Maternal Health Learning and Innovation Center's webinar. Again, good morning or good afternoon. Our webinar is titled Doulas, Supporting Models That Support Families. I wanted to acknowledge our supporting partners here. You can see on the screen, ACOG, Rose, Race for Equity, UNC and Chapel Hill, Association of Maternal and Child Health Program, and Georgia's Health Policy Center. Our webinar today has some learning objectives. The evidence shows that doulas supporting pregnancy and birth improves the health of both the mother and the baby, yet there are many barriers to accessing doula care. In this panel presentation, we will explore insight from doulas and ways of local and state departments can learn from the community-based doula model. At the end of this session, the learners will be able to list at least 3 services commonly provided by doulas, describe how doulas can help promote anti-racist care, describe ways local and state departments can learn from the community-based doula model and the capacity to uplift Black and Indigenous birth cultures' lives. So there'll be 3 parts to this panel, to this program. First, I will begin by introducing our 5 questions. I will ask the questions directly to our panelists. We have 5 panelists. I'll ask them directly, and then they will have time to answer. Then I will ask questions openly to any of the panelists. Anyone can join in and answer. And then finally, Alice will be monitoring the chat and the Q&A, so those on the call can submit questions, and you can post those questions to the Q&A. At the end, we will reserve time to address and answer those questions. So now for our 5 panelists. They will share their knowledge, their insight, and their experience of working with doulas in their community. So first up, I'm going to go outside of that order for a minute. No, I can go inside that order. I apologize. Abra Patkotak with the Alaskan Native Doula. Abra is a doula with the Alaskan Native Doula birth worker community. She oversees a pre-maternal home. And this town, I know I'm going to mess up, and I'm going to apologize up front. Uttoovik and the surrounding communities. I apologize. I know I screwed that up bad. She also works as a police and EMS dispatcher in the Arctic. Next is Miss Hakima Payne. Hakima, known to her community as Mama Hakima, she founded and is the chief executive officer of Ulazi Village, a nonprofit organization dedicated to eliminating health outcome disparities in maternal and infant health in the African American community. Next is Miss Mabel Bacheron of Within Her Birth Services. She is a doula, a DONA certified doula, a Lamaze certified childbirth educator, and a certified lactation consultant. Next up is Miss Sarah Hakima of the DC Birth Doulas. Sarah sees her role as a seed planter, helping the birth community grow wherever she finds herself planted. Sarah is the founder of a nonprofit, Birth Kuwait, and currently is the owner of DC Birth Doulas. Miss Vanessa is next. Vanessa Berrigan of the Alaska Maternal Mortality Review Program. She has been the program manager for the Alaska Maternal Child Death Review Program since January of 2020. She is also the state's Title V Maternal Child Health Block Grant Coordinator. Again, my name is Venus Standard, and I will be the moderator. All of the presenters, you can find their information in the chat, their website, and their full bio. I only read a portion of their bio. Now let's continue. All of our panelists have experience as doulas themselves or working in the role that they support doulas. We're going to start with a conversation by learning a little bit from them and about them, and what doulas do and how they support maternal health outcomes. I'm going to ask the questions directly and giving them time to answer. So Ms. Mabel, thank you for being on our panel. Many people on the webinar are familiar with doulas, but some are not. Can you please tell us a little bit about what doulas do?
Absolutely, and thank you, Venus, and everyone for having me here today. You know, if you were to do a Google search for doulas, what a doula is or what a doula does, I'm pretty sure you'll get this standard definition that a doula is a birth labor assistant, where she may support a family through pregnancy, childbirth, and postpartum by providing informational support, emotional support, and physical support. But I find that definition to be so, such a broad definition, because doulas do so much more than just what you can fine tune in one sentence. I believe that a doula is someone who puts the mother's needs as the priority. They make sure her needs and her desires are respected and well supported. I would even say that a doula or a birth worker, we see ourselves as educators. We see ourselves as advocates and activists and even communicators. I would even go further to say that we are critical thinkers, and in many cases, we analyze evidence so that we can share that with our families so that they can make the best decision for themselves. On top of that, I think that doulas are witnesses, and we stand in the gap to make sure that we reduce harm and prevent trauma, because that does happen. I think above all, a doula does everything she can to make sure that a mother feels that she never ever has to say that I wish I would have known, right? We want moms to be able to feel empowered in their decision making and be well aware of what their options are before they have their first contraction.
Thank you so much. Thank you so much for that. Mama Hakima, welcome. We're so glad you could join us. Can you please tell us why you feel doulas are needed?
Yes, thank you, Venus. I'm delighted to be included on this awesome panel. We need doulas for a simple reason. The healthcare system has failed us. It is failing, it has failed, it continues to fail. And while doulas cannot, make up for all the great failings of the healthcare industrial complex and its interwoven systems, they can stand in the gap for clients, especially BIPOC, that's Black, Indigenous, and people of color, especially for BIPOC clients who are much more likely to bear the burdens of the failings of our current healthcare system. And so doulas are very much needed. With knowledge gatekeeping, doulas provide needed information to families so that they can make true informed choices, and with bias in both access and quality of healthcare. Again, doulas help families navigate the complexities of the healthcare system. And aside from what you think of as their typical role of providing physical and emotional and psychological support, they have a very important, crucial, and critical role in making up for our families and our communities what the system very much lacks and cannot provide in this moment. Hopefully the system is working on improving itself, but until that happens, doulas are necessary.
Thank you so much for that, very much. Ms. Sarah, you work with a group of doula in a group doula practice. You also work with a lot of doulas on your team. Can you tell us about when, in the course of the pregnancy, does the doula typically start working with the family?
Sure. Thank you. You know, I want to preface my answer by saying that there is a wide variety. We've had clients who have reached out to us before they've gotten pregnant to talk through the process and line things up ahead of time. And some clients we work with, you know, until they give birth, and then we don't hear much from them. And some clients we work with for the next 1 to 2 years as they're making their journey through early parenthood. So there's this really wide range, but I would say in general, birth doulas start working with clients sometime around the second trimester, once clients are feeling more confident in their pregnancy. And we are having usually, you know, between 3 and 5 prenatal visits, getting to know them either over the phone or video conference or in their homes. And then we're with them throughout their entire birth. And then we have another 3 to 5 contacts after the birth. And sometimes that's in their home. Sometimes, again, that's video conference or over phone. And again, that's going to look different. I'm giving you a very generalized response, but there are some community doulas who they might have 10 visits during the pregnancy and 10 contact points after the birth. But the goal is that we have consistent contact throughout the pregnancy, during the birth, and after the birth, so that at no point during that time does someone feel like they're falling through the cracks. But there's always someone who is staying in touch and in contact and making sure that they're getting the resources and the support that they need.
Wonderful, thank you very much. Ms. Vanessa, we've heard from Hakima, Mabel, and Sarah about what doulas can offer and why they are important. Can you tell us about how the Alaskan Maternal Mortality Review Program is working with doulas and why?
Yes, thank you so much. And thank you for having me. As I listen to these wonderful doulas kind of talk about their work, I'm reminded so much of what a wonderful experience it has been to bring their knowledge into our program. And Abra hasn't talked yet, and she's the doula here that I have the pleasure of working with through our program. But first, I'll say a little bit about maternal mortality review. I know a lot of the participants today are probably familiar, but it's an evidence-based process where we go through the very rigorous and difficult and heavy work of looking at maternal lives and deaths to really examine the factors behind the disparities that we see. And in Alaska, we see deep disparities for Indigenous birthing people and other groups as well. And we really want to understand what is behind that. And it's difficult for us to examine our system and for us to improve that system without bringing in that lived experience and that bearing witness that Mabel is talking about, and that standing in and helping be there to help fill those gaps, like Hakima is talking about. Those voices really help inform our process to give us the information to identify those gaps so that we can make recommendations that drive prevention and help improve the systems that are behind these disparities. And as I've worked with Abra and brought other Indigenous knowledge into our process and other BIPOC voices into the fatality review process, we've really seen enriched conversation about racism, about historical trauma. What does it mean for there to be a person experiencing violence, or for an infant death to happen, or preterm birth, for someone who's maybe just 2 or 3 generations back, the child of someone who experienced boarding school, and what is that historical trauma through the generations? How does it impact bonding and parenting and health and opportunities? And it's really just deeply enriched our process, and I'm just so grateful.
That is wonderful. Thank you so much. Abra, your turn. You are a doula in Alaska. Can you talk about how your work as a doula considers cultural practices of the community that you work with, and how has that consideration impacted the outcomes that you see?
Yeah, good morning, everyone. I'm so happy to be here. Ovanga nungasuk ut keagavik mugarunga, Patkotak kuyagarunga. So I just shared with you that my name is Nungasuk, that's my Inupiaq name, and I am from the Patkotak family from Utqiagavik, which is the northernmost community in the United States. And I now currently reside in Anchorage on Dena'ina land, and the Dena'ina have stewarded this land for thousands of years. So I've been here for 3 years, and in Utqiagavik, I did run the prematernal home. So taking all those things into consideration with that question, the Alaska is a very large state, and it's, I think, on top of the cultural practices, there's over 200 tribes in Alaska alone. And one of the things that makes it even more difficult for birthing people in Alaska is the distance that they have to travel. And running the prematernal home in Barrow, living there, well, it's 750 miles north of Anchorage, but it's not even the furthest village that people have to travel from their village that might be 1,000 miles from Anchorage into maybe several small planes, several days. So knowing how much work people have to do just to get to Anchorage to deliver their babies, because they might not have a birthing facility in their home community. It might be somewhere a little closer to Anchorage, but a lot of times people are sent even further out. So I think knowing how difficult that can be and understanding the difficulties of just travel is really important when I'm serving these communities as a birth doula, but then also culturally matched care. So as a founding member of the Alaska Native Birthworkers, we have 5 people, and 4 of us are birth doulas and 1 of us is a midwife. And the ability to be there for Alaska Native birthing people and look like them and show up in that room when there might not be other Indigenous people in that space is really important. And it's been a really powerful thing to be a part of the Alaska Native Birthworkers. So we're excited. We're kind of just getting started out. It's been a couple years now, but it's really exciting what we've been able to do in these couple years and the families that we've been able to support.
Wonderful. Thank you so much. So much experience and a wealth of knowledge with this panel. We've had a chance to hear from everybody. Now we're going to open up the questions and anybody can jump in and answer. We know that there's so much benefit in having a doula available for birthing people. So what are the barriers to accessing doula care?
I can speak to that. Traditionally, doulas, which is a fairly new profession, or new name at least, has traditionally been done fee for service. And even though the research showed that doulas, the presence of a doula really could improve health outcomes, that the folks who would most benefit from those improved outcomes were least likely to be able to access a doula, primarily because access was based in fee for service. And so the challenge probably for all of us has been to figure out how to provide those services to the folks who would benefit from them the most, but who had the least access. And I know we've taken on that challenge. We're here in the Midwest, Kansas City, Missouri, by making our work grant funded. So we receive several grants. We have 9 doulas on our staff here at Uzazi Village. And the doulas have their own separate account and their own separate grants that fund them, so that they just have their own separate pot of money that we pay them for. We pay standard market rates which is about $1,200 per client here in our community. And funding doulas is always a challenge, but because these are public health issues, I absolutely believe that doulas should be publicly funded. But I'd love to hear, how everyone else solves that. But how they are funded definitely creates an access issue.
Thank you. Thank you. So how are doulas promoting anti-racist care, racism care?
Well, before we go to that question, could other folks
Yeah, I can
chime in on the
quickly.
deal with access and funding?
Yeah, I'll chime in quickly on that first question, the barriers. I think I love everything Hakima just shared, and I echo that. And we are also a grant-funded organization, and we're able to compensate our doulas, and then at no cost to the families who are requesting those services, which is really important. I think another thing, here in Alaska, sometimes people will birth in their hub communities, and right now there's really not any doulas there, but thankfully we're kind of trying to grow our doula network and be able to offer that so that there can be more support. But it's the distance. So the fact that there's smaller villages, I think it's traditionally, of course, in all cultures, people were supported during birth, and the doula model is just a way to kind of bring that back. So to have more doulas, to raise awareness and let people know about how helpful that doula support is, we'll be able to provide that to more people in Alaska, definitely.
Sarah, would you like to also?
Yeah, I just wanted to chime in. I think Hakima did a great job of talking about the challenges of funding and the need for public funding for doula services. And Abra did a great job of pointing out the limitations of geographic access. I wanted to bring in the perspective of sort of the supply side, the professional side. It can be difficult to find doulas in your area because doula work is hard work and there's a high attrition rate. And so I'm part of trainings on a regular basis where we're training these large rooms of 25, 30 new doulas. But when you follow up with them in 1, 2, 5, 7 years, there are very few who are still in the professional field working full-time as a professional doula. And the 24 hours, 7 days a week, all year round on call stress can be a lot. And so what we have tried to design is a business model that supports our doulas so that we have a higher retention rate and makes the doula profession sustainable, so we don't have as high of a burnout rate.
Thank you, Sarah. I would like to finally add, in the case of the concept of doula work in the local community, a lot of women kind of view doulas as a luxury, or almost like it's a trend, like it's something that just popped up recently, and so therefore it doesn't apply to them. And even speaking more so to the Black community, a lot of women just may not even know that that's something that can be an option for them during their pregnancy and childbirth experience. And so I think for a lot of doulas who are, knee deep in this work, we're working extra hard to let women know that if you want a doula, you deserve one, and you should have one, no matter the cost, no matter your location, no matter what point of your pregnancy that you may be in.
Thank you very much. Now we'll go on to the next question. How are doulas promoting anti-racist care?
I'd love to jump in on that one too, because that's certainly the crux of our work here at Uzazi Village is we see our doulas as the first line of maternal and fetal support as they enter toxic systems that again, our doulas act as navigators within those systems. And so anti-racist care is the hallmark of all that we do here. And we're very invested in encouraging, coaxing, fostering, bullying, whatever we need to do, systems into examining the racism embedded in their care models so that they can work to root that out. So I would answer your question by saying our doulas primarily serve as mentors and models of what anti-racist care should look like. And we model that for toxic systems that need to understand the traumatic impact that they're having on our community families. But racism is very much embedded in healthcare. Very shocking not too long ago to see JAMA, I believe it was JAMA, published something that said there was no racism in medicine. Well, nothing could be further from the truth. It's in and through and woven into every fiber of its organizational structure. Because healthcare is no different from any other structure in our society. They're all racist, or all manifest a racist impact. And so we absolutely need models to show those structures what non-racist forms or anti-racist forms of healthcare look like. And often they are embedded in culturally congruent models, or what Abra called cultural matching models. So the anti-racist aspect is really, really key to what we do. And if institutions aren't having conversations about how to become more anti-racist, then they are totally missing the boat. And they are not understanding the harm that they can cause. But again, I'd love to hear what others say about what they see happening in their parts of the country.
I definitely echo everything Hakima shared. Thank you so much. Yep, that was so true. And someone pointed something out to me recently, a member of our organization, that was so simple and kind of eye-opening, but it was such a good point. She said, you know, sometimes just being there and being a witness to what's happening in that room with that birthing person will change the attitude of those healthcare professionals. And just so if there were, you know, anything that might prejudice that might exist, that they would that birthing person would experience. So just being there, being an advocate for that birthing person and speaking up on their behalf so that they get their needs met in the best possible way, I think is a big factor as well.
You're right, Abra. I totally agree in regards to doulas serving as a witness in that capacity. And at times it changes the birth environment, and from a very tense one to probably one that's a bit more calm. I would even say from, you know, I serve as a doula to individual clients. So a lot of our work is done before moms go into delivery. So having conversations in regards to how to recognize coercion and abuse before it happens, or even having conversations about what your rights are as a patient beforehand so that they can feel confident in being able to speak up for their needs when things happen, or there are things that are out of turn. And so really a lot of the work that is done is really building that relationship with the family so that they can understand their rights and their autonomy in birth.
I love everything that Evan has said about what doulas do. I just want to add to it that part of our modeling and being a witness is that we can help hold providers accountable. When we see a provider moving forward with a procedure without going through a proper shared decision-making process, we can verbally share to the room, hey, Jennifer, are you ready now for this next part of your exam, or are you ready to take this next step? And that's a check for that provider, like, oh, hey, I skipped that part. Let me back up and approach this a little bit differently. And so I think when we spend time as doulas practicing advocacy, appropriate advocacy, then we can help hold providers accountable.
Ms. Vanessa, would you like to weigh in on that before we move to the next question?
Sure, thank you. I think our perspective is a little bit different, but I'm really enjoying kind of listening to this conversation because it's all of the things behind why it's so important to have doulas come into the fertility review process. And we have a de-identified process. So to the extent possible, we don't, Alaska is a quote unquote small state, but to the extent possible, we don't know who we're talking about. And we don't use first names of the deaths, the lives and deaths that we're reviewing. But it's really, really helpful to have the doula perspective in the room to kind of to stand up for patients' rights and to stand up for the birthing person and to talk about, you know, points in the patient care where perhaps the person wasn't listened to, or to really bring to the surface those conversations about racism and about bias, because I've had the experience of kind of observing my review processes, and I like to stand back and observe them. I don't facilitate them myself typically. And I'll see it be asked, you know, that question will come up, was institutional racism a factor in this death? And my panelists will kind of sit there for a minute and then they'll be like, well, I don't really see it in the records. And so then a doula often, or someone with a similar kind of patient perspective or lived experience, will stand up and say, well, what exactly would you expect to see in that record? You know, and to really kind of tease out those nuances about, you know, what that would look like. Those conversations are really difficult, and I really want to get our program, and I hope that other fertility reviews around the nation are working on this too. And from what I've talked about with my peers, I know that they are, to where we can have these conversations without BIPOC panelists kind of holding our hands and doing that difficult work for us, because that's really difficult to put a person with lived experience in that position and to ask them to constantly be teaching us. That's where we're at right now. And so the best that I can do is try to, you know, practice humility and gratitude, and learn and just listen and learn the best that I can. And try not to make our BIPOC panelists explain things over and over. And it's a process. And as we learn from them, I'm seeing some of our other panelists start to bring forward these conversations on their own without being prompted as much. So it's a really valuable process.
Thank you, Vanessa. I really appreciate that perspective. We've been working here in Missouri and Kansas to try and establish maternal near-miss review boards, so keep people off fatality review boards by examining and learning from near-miss. For those who don't know, that's when you almost die, but you don't die as a result of a medical event. And so it's really good for me to hear that doulas have a role in that space, a really important role. And I actually think it is important for healthcare providers, administrators, ethicists, whoever, you know, make up those boards, other professionals, to hear from doulas, maybe even as a stand-in, you know, as the community voice. But I really appreciate your comments, and I think that's an appropriate role for them until we get to a place where folks don't need that hand holding or have gained that perspective. So thank you for that.
Thank you. I think the representation will always be important. I think I kind of have this in the back of my mind, since we have a large tribal population in Alaska. I feel like we should never be reviewing the death of a tribal person without a tribal voice at the table, and preferably more than one, so they're not alone in that experience. But that's a little bit different than having them kind of holding our hand through the process. So thank you, Hakima.
Thank you, everybody. Ms. Vanessa, you touched on how a doula directly or indirectly can hold the providers accountable, hold the team accountable. So how can the healthcare provider support the doula?
Yeah, I think all of us could probably weigh in on that, but I'm happy to get us started. And I think really for just an important start is to be respectful and to understand the doula's role and their value, and to listen to them, to give them a place and a space and to appreciate the relationship that they have with the patient, and to really value that connection, because providers are really busy. They don't always have time to form that connection with the patient, and they can really benefit from working together as a team and respect.
Okay, anybody else? Okay, we'll move on to the next question. How can local and state departments learn from doulas to support community-based doula services?
Well, I'll take that one on, because I think local and state departments largely exist in a state of unawareness, so they need to be asking the questions. And also we should be looking to local, but especially state health departments to be funding doula programs. You know, the states do get the maternal, I forget which title number it is, but the maternal child health funding grants. And I absolutely believe that doula programs should be aligned on those budgets. And that is one way that, because this is a public health issue, it warrants public health funding to help solve. And, you know, establishing, you know, these pockets of funding that come through the maternal child health grants might be one way to assure that communities that need it most can access funding for doulas.
Okay, thank you. Anybody else want to chime in on that one?
Yeah, I just wanted to add that, you know, in addition to the financial support, looking at what doula practice models, how they might look and work effectively. So looking at, there are a really wide variety of how doulas practice, and seeing what works successfully and what's sustainable. And also investing that financial support needs to not only support, you know, kind of that fee for service, but professional development and training. We need, if we want more culturally congruent care, we need a lot of investment in training from within communities that we want to serve better.
Right, I think that training is often inaccessible, even though there's training out there. Yes, there needs to be funding directed at raising up specifically Black, Indigenous, Latinx doulas, so that communities have their own embedded doulas available to them. So yes, focused funding. I also think within that we need to establish national standards for what is a doula, what does a doula do. And I think there are groups, I've even been a part of such efforts, that are working to establish those national standards, so that when we're having those conversations, you know, around the state table, you know, we're all talking about the same thing.
Absolutely.
Since this, oh.
No, go ahead, Vanessa.
Since this question is about the state, I would like to add one thing. Alaska was recently accepted, and I think there's 5 other states that was accepted to the Healthy Beginnings Learning Cohort through AMCHIP and Title V. So we'll be working with the Alaska Native Birthworkers community on looking at anti-racism and preterm birth specifically, and looking at funding, Title V funding specifically as part of that, as well as how we share our data and how we look at data for equity. And so it's really exciting. It's a facilitated kind of learning space, primarily for us as the state agency, to learn from Alaska Native birthworkers. And there were a couple of, I think, community agencies that applied, and we are super excited to have been accepted, and especially to work with our wonderful doula agency that we've partnered with a little bit, and to really deepen that relationship.
I would add that someone posted in the chat box about DONA certification being paid for in North Carolina. That's one of the reasons I think we need these national conversations, and people like me are a part of those conversations. I'm a not only run a doula agency, we do doula training, and to name any specific body as a certifier is probably not appropriate. And so we see lots of states leaning on one or two organizations that have been around the longest, but that doesn't make those organizations the most appropriate, especially if they're preparing doulas to work in communities of color. There are agencies such as my own, our perinatal doula training, but there's lots of others. There's one out of Mama Toto in Washington, D.C., and Jenny Joseph has her own training. There's one in St. Louis, Jamal Birth Village. There's so many Black-led, Black organized, Black-run doula certification and training programs that exist around the country, and we can't shut out those agencies either when we're having the discussion, because they're preparing the doulas who are community-based doulas, which is different from traditional doulas. Community-based doulas are really prepared to work with what some would call at risk. I don't use that kind of language anymore, but would use to work with very specific clientele within very specific communities. Those agencies, those organizations are really being overlooked, and they should not be, in favor of organizations that really have, even though they have longevity, they really have less credentialing to prepare the community-based doula for community-based work.
I agree with you, Ms. Hakima, especially in regards to recognizing the vast majority of training organizations that are out there for doulas, and also circling this point back to your previous question, Venus, in regards to what healthcare providers can do to support doulas, is also given the current state of COVID and how a lot of hospitals are still restricting doula support. They're restricting patients down to just one support person, leaving the mother to only decide between her partner or possibly including a doula. And then even for some hospitals that are welcoming doulas back into the hospital, they're narrowing it down to very specific training organizations, saying that you must be certified by X organization, and therefore cutting out a majority of doulas who are just as qualified to support moms. So I think as a healthcare provider, they should be having conversations within their hospital and within their local community as to why doulas are necessary in the hospital setting, and limiting those restrictions so that everyone can get the quality care that they deserve and desire.
These are really difficult questions, particularly when we're talking about, and I don't want to like step on or take Abra's voice or her opportunity to speak, but I feel when we talk about standardization or credentialing and Indigenous doulas in particular, we're talking about birthing practices that have been passed through generations since time immemorial, and my hackles go up and I think about colonization, but the fact that, you know, without these things, doulas are being denied access to hospitals is a major issue. But there's also patient safety and hospital regulations and all these things to work through and think about. So it's just, I guess I'm just kind of thinking out loud that these are the things that come to my mind, and these are the barriers that we need to work through. I saw Abra unmute, so I'll stop talking.
Yeah. No, I wasn't trying to rush you. I was just excited because I was thinking about a couple of things here, and I'm so glad you brought that up, Vanessa, about the training aspect and how I was trained as a birth doula in Oregon to over a decade ago now, but the access to that isn't always available. So really exciting thing that our Alaskan Native Birthworkers organization was able to do. We hosted the Indigenous full spectrum doula training with Anishinaabe Dene midwife Melissa Brown in May, which was so awesome. And now we have 11 well, there's more than that. I'm not sure the exact number, but 11 different Alaskan communities now have birth doulas there, and they're all Indigenous. And so we serve Indigenous people in Alaska. And one thing, Mabel, you brought up during COVID, we can't have, a lot of times birthing people are not allowed more than one person. It's really wonderful here in Anchorage, at least at the Alaska Native Medical Center, where I attend many births. They are allowing a birth doula. And sadly, a couple of the other hospitals aren't. They might have changed that. I haven't checked the most recent, but that was definitely a big issue. It's not okay to bar people from being there and being present when doulas, when it's shown how much they help with positive outcomes and birthing outcomes. So there's a couple things there, but it is really exciting to think about this, the Indigenous full spectrum doula training being offered for more Indigenous people, having that out there.
Wonderful. We've touched on quite a few things, but now let's talk about payment. Can you talk about efforts you've been involved in or know of to get doulas covered by health insurance? And what about other payment sources? Anybody?
Well, Hakima and I already did mention, like, both of the organizations that we're a part of, we have grant money to pay for our doulas. I don't know that much about the efforts of getting doula services covered by health insurance, so I won't speak to that necessarily, but it's, I guess in this case, we saw the need and we're like, okay, well, we need doulas, and not me specifically, but me and the co-founders of Alaska Native Birthworkers, who I don't actually write the grants. We have some amazing, a team member who just does incredible things and makes that possible. But yeah, saw that need happen and is making it happen so that births will be attended by a doula, and that doula will be equitably paid, and that family doesn't have to pay for it, which is wonderful. For health insurance wise, I can't really speak to that, but
I think I can speak to that at least a little bit, because in our earlier days we did experiment a little bit with reimbursement from the Medicaid MCOs, at least here in our area. I think insurance companies, to their shame, have been very slow to this conversation. They actually are the natural payer for doula services. When we look at all the stakeholders who benefit from childbearing persons having improved health outcomes and their infants having improved outcomes, one of the biggest beneficiaries is insurance companies. You keep a baby out of the NICU and you've saved tens of thousands of dollars for that insurance company, and frankly they should be paying. So we've talked about possible forms of remuneration for doula care. We've talked about Title X funding. We've talked about grants, which is the most precarious and really the least likely that we should be pursuing. But what we should really be pursuing is insurance reimbursement, and possibly a conversation about Medicaid reimbursement. But those folks are the latest to join the table for these conversations. But we absolutely should be talking about insurance reimbursement for doula services.
Wonderful.
Yes to everything that Hakima just said. And I just want to add, there are states, at least like 13 to 15 states, that have legislation in the process of getting doula services approved by Medicaid. And there are some states where it has been approved, and there are programs or pilot programs mostly actively in the works. Florida, Minnesota, Oregon, Washington,
New Jersey's
Massachusetts,
doing it too. New Jersey.
Right. DC just passed something in city council where they're working on a pilot program. So there's a lot of momentum, but there's lots of learning curves where, you know, in the earlier states that passed legislation were reimbursing really low and had low uptake to the program. And so now the other states are learning from that. And I think everybody's kind of learning, but it needs to be faster. It does not need to take this long.
And we are learning lessons along the way. I keep a close eye on states that are considering Medicaid reimbursement legislation. Some of that legislation is really poor, really bad, and other legislation holds promise. But I think we have to be really careful with Medicaid reimbursement. Often with that kind of reimbursement model comes a lot of regulation, and we don't want to regulate Black and Indigenous doulas out of existence like we legislated Black midwives out of existence. That really happened. So we need to learn from our history. And so we just need to proceed really cautiously, I believe, with Medicaid legislation, because there's some really destructive laws out there that will probably do more to end doula care in their state than to promote it if we're not careful.
We're going to move on since this has been such an exciting conversation. We're going to move on to the chat questions now. This first question is directed to Abra. Regarding respectful care, when cultural and concurrent is not available, it's not possible, do you have experience serving Black women? If so, are their outcomes the same as Native women who received the support?
That's a great question. And here in Alaska, on the North Slope where I ran the prematernal home, most people are Alaskan Native. And here in Anchorage, we serve mostly Indigenous people. So I don't actually have experience serving Black birthing people or Black women. Our work as Alaskan Native birth workers is more about serving Indigenous. We would, of course, open the services up, but most people in Alaska, because Alaska's an Indigenous, originally Indigenous, there haven't been that many Black people. There are Black and Indigenous people here, though. So just so far, though, I've only served Alaskan Native people in Alaska.
Okay.
Also comment on that from the maternal mortality review perspective. We work with really small numbers from a data perspective in Alaska, even for our Indigenous and white populations, which is the majority of our population in Alaska. But we actually do have a pretty diverse population, and we do see maternal deaths among Black women, which, just considering the fact that we have so few Black women in Alaska, should not be happening, but the numbers are too small to compute any type of a rate or anything like that. We do have one Black and Indigenous doula who is amazing. She's very young and new. You probably know Delicia Abra. She's wonderful, and she actually is interested in working with the maternal mortality review, and is kind of an emerging young professional who's interested in midwifery. So I think that, that's really promising, and that she would be there for Black birthing women, but access, she's a private doula, so access is an issue, and just kind of exploring how we can support her is something that we should be looking at.
And actually, Delicia is there for us as well because we're a small organization, Alaskan Native Birth Workers. She responds to births as well when we have requests that we can't meet, just because there's right now so few of us. We're still growing our network. So Delicia is amazing.
This next question that's in the chat was, I think, just recently addressed. So it says, do all of you think that non-regulated nature of doula profession is a benefit or a hindrance to doula work? And do you have concerns regarding regulations with the increased visibility of doula work?
Yeah, I saw that question and I think I kind of already talked about it a little bit, but I do have concerns. And like I said, colonization is the first thing that comes to my mind. And it's just something to watch. I think that on the one hand, some regulations and certifications or credentialing can be empowering. And on the other hand, it can be oppressive and colonizing. So we just have to, like Hakima said, watch that really closely. I don't know if anyone else has anything else to say.
Yeah, I think I answered that already too. Yeah.
Yeah, I agree with you, Hakima and Vanessa, especially the concern of doula work being overregulated to the point where doulas cannot make a livable wage off of the work that they do, or thinking about the case of burnout where they have a high clientele, a high workload, but they're not really getting compensated appropriately for the care that they're providing. So regulation definitely has its pros and cons.
Next question. What is being done to get more healthcare professionals to respect the role of the doula, that the doula plays? And then this person states, I feel most of our healthcare professionals take the easy way out, pushing cesareans when they're not needed, when given the slightest opportunity. Please comment.
Oh, well, I certainly have some thoughts about that. I think doulas absolutely do, even though doulas are not healthcare professionals, they should be respected as a part of the birth team. And so a lot of what you see around how doulas are treated is that lack of respect, sometimes a lack of not knowing, but usually just a lack of respect for their role. I, again, love Vanessa's idea of doulas sitting on these panels. We have a femur here, fetal infant mortality review, child mortality review boards. We have fatality review boards here, and seeing doulas, recognized as a part of boards like that, or other decision-making boards or strategy creating boards around perinatal health, seeing doulas as a part of that, I think would go a long way toward engendering some of that needed respect that doulas lack. But mainly, I would say the answer to that, that's on healthcare providers. They need to get their act together and meet their own learning curve if they don't understand the importance of the role of doulas. They need to get out there and figure that out.
Yeah, everything that Hakima just said, and just adding that this is where regulation could potentially play a role in helping to create a standardized set of practice guidelines for doulas. I think part of the challenge is some providers are not sure what to expect with a doula, because some doulas are checking cervixes and touching machines, and other doulas consider that type of work outside of their scope of practice. Mm-hmm. And so having, communicating clearly what our scope of practice is, and respecting the work that they do and valuing the work that they do, respecting one another, has helped us create really positive relationships with the providers in our area.
Sarah, I'd say any doula who's checking a cervix is practicing outside their scope of a doula. That is not what a doula is. So,
but we don't have any national standards that say that, right? Right.
That is correct. We don't in this moment. they are coming, but I think there's a fair understanding that that's outside the scope of a doula. I think that's common knowledge and common sense that is not what doulas do. We do not do medical procedures.
Yeah.
The next question, birth doulas and midwives, is this historical in nomenclature, or have this definition identified separate roles? If so, what are the differences, the trainings, the locations of practice, co-workers, families seeking different services?
I think that doulas and midwives are often confused with each other because essentially our approach to care is very much the same in terms of empathy and compassionate care, and it's very individualized as well. So the midwifery model of care really centers in on the patient as, you know, the primary authority over her body and her pregnancy, and there is a lot of engagement to encourage the mom to feel as integrated in this birth experience and not look at the midwife or the provider as the authoritative role in that experience. And so I think a lot of doulas or a lot of people confuse the terminology, but like we talked about previously, there is a scope of practice that doulas just do not step into, and that includes anything having to do with medical intervention. So like we said, cervixes should not be checked, and you know, even I would even say if a doula has a medical background, there still is a line of demarcation in terms of how she's supposed to serve the client. And so I think there's a lot of intertwining in terms of the heart and the passion that we serve our patients, but the scope of practice varies differently when it comes to providing medical care versus not providing medical care.
And if you're still asking what's the difference between a doula and a midwife, you just don't know enough. You need to educate yourself. They are not the same thing. They aren't anywhere near the same thing.
The next question wants to know what's the difference between a doula and a perinatal health worker?
I'll answer that too, because we also require all of our doulas to become community health workers. So all of our doulas are double certified. And I train community health workers. I also do that training here in my community under a local community college. So the scope of practice is varied. So I would say the community health worker probably has a broader scope. They're more focused on home visiting and providing resources for folks who are already tapped into a medical home and are having a specific medical issue tended to, and usually a community health worker is assigned to them for follow through on their therapeutic treatment plan and things of that nature, and to provide resources. Whereas doula care, I would say, is definitely focused on the perinatal. Community health workers, you know, work usually in chronic disease or mental health, or, you know, across the broad spectrum of healthcare need, whereas doulas are very specifically perinatal in nature. Although full spectrum doulas do a variety of things, but they're all in that perinatal pocket. But I find that our doulas benefit from having the community health worker certification because they learn more about resource allocation and finding and tapping into resources, and the home visiting piece, which I would definitely consider a doula program to be a home visiting program. And for our state, one of the other reasons I made that choice is that our state community health workers can receive reimbursement, and doulas don't. We don't have that legislation yet in our two states here. Kansas City's a border town. We're on the border between Kansas and Missouri, so we have to deal with the laws in both states. But neither of those states have doula legislation, so our doulas have a possibility of reimbursement as community health workers, if not for doulas at this point. but I do see the certifications as complementary to one another.
Thank you. The next question states, we live in a male-dominant world. How can it involve men into the conversation so they can understand the mother-infant dyad and also advocate for women? I say her story is his story because his life is affected by how his mother was supported, which makes a difference in his life.
I will just say I don't think the world should be male dominated. And so that's an issue. Misogyny, patriarchy are just as sinister forces as racism and capitalism. So that's not the world I'm trying to live in. I'm trying to change those dynamics.
Okay, thank you. The next question is, what are some reputable sites for doula certification? I see a variety of programs ranging in length of weeks to years.
I would say before we move on to the next question, I didn't want to necessarily leave it at that. If someone else wants to address the role of men in this work, I think that's an important question to be answered. I just wanted to throw in my 2 cents worth.
Well, I would add, just from personal experience, that a lot of men hesitate at the concept of having a doula in the whole pregnancy and birth experience because they may feel that the doula is there to take their place or, kind of, push them to the side and just engage with the mom alone. But the beauty of doula work in any family is that everyone is working together as a moving unit. There are so many ways in which a doula can help engage the partner to help ensure that the mom feels well supported and grounded and respected. I think in some of the most unique cases is when the relationship is so strong between the partner and the mother or birthing person that the doula doesn't have to do much, and you see the father is just engaging in a way that really helps let labor progress smoothly and also have a satisfying experience. Usually, at least in my case, the fathers are a bit hesitant when they hire me, but it's until after everything is done, they look at us and they're like, we couldn't have done this without you. So it's really just helping the men see their role, and their part is just as important and viable in making sure that the experience is satisfying.
Thanks, Mabel. I have a couple things just from thinking about how doula services are often recommended in the review process. And postpartum doulas in particular, I think may have a role in engaging the partner, regardless of their gender, with a birthing person and making sure that they know how to support the birthing person if there's postpartum depression or, interpersonal or relationship stressors or needs for support, that the postpartum doula can do a lot of things and be just in the home and be a person there to kind of help identify risk factors and things that might be going on. Just that, that in-home support. And then also, I think just what Hakima said made me think, and I 100% agree with her. That was my initial gut reaction to that very fair question. But it made me think of how some of our doulas and midwives as well are helping to bring up discussions about gender and gender justice within our review process and just within maternal care. And Title V work in general, and helping us think about using equitable language and thinking about, gender norms and being inclusive and just kind of, all of those things. And Abra is really a wonderful advocate to that. And if you read the rest of my bio, LGBTQ equity has been one of my focus areas in my own work. So I really appreciate her for that.
Anybody else? Okay. Let's jump back to that certification question. Are there reputable sites for doula certification? There's a variety of programs, ranges in lengths and from weeks to years.
I think everyone has to do their own research on that and figure out what's accessible to them, what's affordable to them, and just do their own due diligence on finding what the right program, whether it's training or certification, might be for them.
Anybody else on that question?
I also think that a lot of doulas find that they may go through multiple trainings throughout their time as a birth worker. So it's not necessarily getting trained initially for certification, but also pursuing continuing education throughout the course of your time as a birth worker.
Okay.
Yeah. Yeah, and I was so excited that we were able to do the Indigenous doula training here and make that more accessible. There, it's really varied. And I think people who are, well, Black, Indigenous, people of color, birth, people have been there supporting people at birth forever. So I think I mentioned this earlier, but it's just kind of bringing that back and having those support people there for those births. That's just the natural way of things. So sometimes people fall into that role early on and just end up attending births. They don't even know they're a birth doula. It's like, I know people here in Alaska who are Alaska Native, and oh yeah, I've been to hundreds of births, but they're not a midwife. They have that many cousins, and then they end up at their births supporting people, and they're just naturally in that role. So, and then there's also trainings that like I said, I was trained in Oregon, and we were able to just do another training here in May. What Mabel said is right as well, just continuing to stay up and keep educated, and then educate. Actually, one thing I wanted to say too about culturally matched care, when you're serving someone outside of your culture, especially a BIPOC person, I think it's really important to learn about the health inequities that they're facing and the adverse health outcomes that they're going through. So if you're a healthcare provider or a birth doula who's serving people outside of your culture, that's something so important to remember. Just educate yourself so that you can provide the best possible care for that person. It's a little bit outside of the scope of that question, but something I wanted to say.
Thank you. The next question is directed to Sarah. Can you share a few strategies from your program that you use to minimize burnout among doulas?
Sure. I was a solo doula for about 15 years and struggled with, I would be at a birth for like 3 days long, or gotten home from a birth and another client calls and they're in labor and I haven't gotten any sleep, or I'd missed my child's birthday 2 years in a row, all the sacrifices you make. And when I moved to DC from Kuwait, the opportunity of starting to sort of mentor new doulas. And I found that I loved that, working with colleagues. As a solo doula, I'd always by myself for so long. And so when I moved to DC, I was able to start working with a group of other doulas, and needed DC birth doulas. And we have group practices where clients hire us, and our team is designed to support one another, to support the doulas. So we have a shared call schedule. And so I can make sure that I'm not on call when it's my son's birthday, or if I want to go out of town for a weekend. So we share that call schedule and the burden of answering phones and going to births on another up. So if someone has birth, we switch out and another doula from the team replaces at home, and so really get the best quality care. They get a fresh doula that has been rested and is ready to keep supporting them. We do training together. We share resources and share the burden of the doula work that we do, and it makes all of us It's this sense of sort of like abundance, whereas a solo doula, I felt this scarcity all the time. Like I can't do more. And when I'm working with a team, there's this abundance, like there's going to be enough. There's enough people, there's enough time. We're all here. Backs.
Thank you. We have 2 more questions. As a doula, have you ever found yourself in a situation with domestic violence, and how did you handle it?
I have not, as at a birth or as a doula. In my other careers and professions, I've dealt with a lot of domestic violence, and I think it's really scary and difficult to deal with that. And I think just having resources available for people, being an advocate in your community, making those resources readily available to people, providing information, I don't know, being a good role model, just it's difficult to know where to even start with the domestic violence issues. So that was more of when I was a emergency dispatcher on the North Slope Borough. That's when I dealt with a lot of that, and thankfully have not dealt with that in a birthing space. So I don't know if anyone else can speak to that as a birth doula, but thankfully it's been positive experience, and of course not always positive, but domestic violence wise and in the birthing space, I haven't experienced that yet.
I would just say I don't see the relevancy of that question to this discussion.
I can answer. I have a little bit of something to say on that. We do have, I mean, Alaska has pretty high rates of interpersonal violence, and we have had conversations and requests for training from the home visitors, which is of course different from doulas, but our home visitors requested some support with really the vicarious trauma around going into homes where there are power dynamics, power and control dynamics, and really what to do when they pick up on those things impacting the caregivers that they're working with. And so there was a training that happened. It was virtual, and it was incredibly popular. And I think that our section is looking at offering something like that. Again, it wasn't, specific to doulas, but I think that there could be an opportunity for birth workers to potentially benefit from something like that. And we do often, we do have quite a few, we're reviewing maternal deaths that are pregnancy associated deaths. So they're deaths from any cause within a year of a pregnancy. So not just necessarily directly related to the complications or the birth itself or the pregnancy itself. So that does include homicides and suicides and other violent deaths. So we often do see home visiting and doula support services recommended for prevention of prevention of deaths due to interpersonal violence. And that's because that support and that social support and that connection and just having a person that is partnering with the birthing person and who can know that something's happening and perhaps make a referral. Not to put a doula in the role of, preventing or being responsible for stopping the violence, because that's not your job. That's a huge ask. But just to provide that social support, I think is what our panelists are thinking about. And so I think it's a fair question to, respectfully disagree. But it's a hard question. And maybe that's just Alaska having different dynamics and different history with interpersonal violence. But I think really that self-care and really thinking about that vicarious trauma when you're working with someone who's exposed to violence, and then just being educated, talk to a domestic violence advocate and make sure that you understand what power and control dynamics look like and how to kind of pick up on them, and then how to get the support and connect that person with the support that they need, so that you're not taking that all on yourself, because those are really complex situations and they can be really dangerous.
Last question. Do you think the consistent funding for doulas will positively impact the attrition issue? If yes, what else is needed to make that happen?
I think it needs to be adequate funding. I think a lot of the state pilots that I've seen and a lot of the legislation that it has passed keeps doulas starving because they don't fairly and equitably compensate. And so there's, it depends on how they're funded, at what level they're funded.
I also think that funding is one piece of the puzzle. We also need to build a relationship with the healthcare system. And I'm not saying that doulas need to be integrated into the healthcare system, but how are clients even supposed to know what doula care is and how it can benefit them in their birth if, you know, most people when they become pregnant go to a doctor and they just assume whatever I need to know, the doctor's going to tell me. And so if we don't also have an education portion to the solution, then I think we're going to lose doulas because there's not going to be that connection to the clients that we're working with.
And I think that's really true, Sarah. I think ultimately doulas function as a stopgap in our current deficient system. And ultimately what we want are systems that actually work for people. That's the day I want to see. But I do think doulas can help get us there.
Thank you so much, ladies. This has been wonderful. Does anybody have any last quick words of thought? No? Okay.
I would say as far as work with Black doulas, I really support the policy work of Black Mamas Matter. So I'd urge folks to go to their website, look at the policy strategies that they created there. I think there's really excellent work that comes out of Black Mamas Matter that we all could learn from. So I'll give them a plug.
Wonderful. Thank you so much. We're going to put up the Rose slide right now. This is a wonderful organization and they're having an event July 20th to 22nd of this year. It's the annual Breastfeeding and Equity. It's a virtual summit, Reckoning and Resilience. So please go to that link, which will be in the chat, and register for the Rose Summit. I'd like to thank everybody, our panelists, and everybody that joined us. We had almost 200 people join us today. I appreciate everyone. I appreciate everybody's thoughts, comments, and expertise. And thank you very much and have a wonderful day.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you so much, everyone.